It gives me great pleasure to welcome Dr. Russ Rockne, who actually did also attend our last meeting here at the Don Cesar. But he's going to talk about something very different, and we're kind of intrigued about what we can use machine learning for with our mathematical modeling. So, Russ, take it away.
Thanks, Sandy. Okay, hi, everybody. First of all, thank you, Sandy and Kristen, for inviting me and for putting this on and for leading this field in a lot of ways. You're kind of the field's parents in a way, so thank you for that. Really appreciate it, sincerely. The work I'm going to talk about today is like a lot of things that we do in this room, very collaborative work. It's in collaboration with engineer Jenny Munson, who's at Virginia Tech, and people in her lab, including an IMO Moffitt alumnus, Jessica Cunningham, who many of you might know. She's involved in this work, and then Ryan's in my group. This work really centers around asking a question about how we measure and take advantage of interstitial flow. Interstitial fluid flow is the flow of any kind of fluid in the extracellular spaces. Okay, so it can be blood. In tumors, it's often blood. In the brain, it can be CSF, it can be plasma, it can be lots of things. And it's incredibly important as a biomarker and is something that, is basically physical in nature, right? So if you watch this movie, this is contrast agent dye coming out of blood vessels into interstitial spaces. And this is something that, can be physically modeled through transport equations. It's also incredibly important in how disease progresses and manifests. So inside tumors, there's interstitial fluid pressure, which can drive solid stress in and around the tumor and on the surrounding tissue. This is a picture of a slice of brain where you have different cell types, just showing that as we think about how and where tumors are going to expand and grow, the pressure gradient that's induced by both its growth and the fluid flow is really important. And this is something that we can measure non-invasively and fairly routinely. So this is a movie of a dynamic contrast enhanced MRI, which has already been talked about a little bit this morning. What you're looking at on the left is sequential MRIs taken from a patient as they are in the scanner before, during, and after the injection of a contrast agent. And then the graph is showing you how that concentration accumulates over time in this green window, this green region of interest where you see it go from dark to increasingly bright. And this is a scan that's routinely collected, okay? So especially in solid tumors, mostly in brain, this is the kind of scan that can be done anywhere there's an MRI. There's nothing really special about it, nothing really fancy about it. But in order to analyze it and interpret it, you have to do something with these time activity curves. And this curve that is being drawn with this movie, by the way, is in like 1 voxel. And the way that's done is by fitting an ODE to each voxel. And by what I mean by the way it's done is literally everywhere in the world, hundreds of papers a year, fits compartment models of the contrast agent exchange. So the contrast agent goes from the blood into the tissue and back. And there are these transport rate constants, okay? But this is an incredibly tricky process to do, actually. I had a postdoc, Martina Conte, who's now a faculty track member in Italy, who she said, sent me this email like, hey, I'd really love to come to City of Hope and work with you because a lot of the modeling I've been doing is theoretical and I want to apply it to data. And I laughed and I was like, yeah, no, you don't. You're going to regret saying that because data is a disaster. And she said, no, I really want to do MRI data and I want to look at some of the perfusion stuff you're interested in and this fluid flow stuff. I said, okay, well, all right. And she very quickly realized that this is a disaster. It's a really hard problem. And the first paper she produced out of this data was to basically show that these models that we use, these ODE models that we use, some of them are not structurally or practically identifiable. So the reason why it's a hard problem to solve is because a lot of times you can't even actually do it mathematically. And so like if you take some of these curves, smooth them out and start looking at likelihood functions of parameter identifiability, you actually start to see that the data actually has to be quite smooth in order to have a real confidence that you've even hit one of these very simple parameters in a very simple ODE model. Okay, so that's really the motivation and context for where we're going, because the problem talk about how we're using different kinds of tools is really how to get more better and more reliable methods to measure fluid flow and velocity in tissues. And so whenever we do this kind of exercise, and people in this room, in this field of mathematical modeling, right, is like drawing. Okay, so some of you may know I have an art degree in math and in art. I love art. And this is how a lot of drawing classes go, basically, right? Draw some circles and then draw the rest of the effing owl. Okay. That is how modeling works. Make some approximations and then basically just get it done. Okay. But that's because modeling is an art, and there's no right way or wrong way to make a model. Oh, you know what? Besides thanking Kristen and Cindy, one of the other things I was going to say at the beginning that I forgot is that I looked up the word didactic for didactic lecture. And it turns out that didactic actually is not only an instruction, but from a moral perspective. Okay. I didn't know that. I hadn't appreciated about that word. So I'm going to inject some modeling morality into this talk. Okay. And when it comes to modeling morality, modeling is an art. Okay. During the course of this meeting, you'll see all kinds of different models asking and answering different kinds of questions. And like art, it's kind of in the eye of the beholder. And this great quote from Picasso is that art is really about the process of removing the unnecessary. So as we build mathematical models, you think, okay, what are the most minimal parts we need in order to capture what it is we're doing? Some really cool examples of that here on this slide. And I think that really the future of our field is going to be this integration of machine learning and mathematical modeling. And so I'll show you how we're going to do that. But does anybody recognize this picture? Yeah. Thank you, Sandy. Okay. Thank you. 2 people. Oh my God. Shame on you. Pink Floyd, wish you were here. So the basic concept comes from this algorithm that was published originally in 2016 called SINDI, okay, sparse identification of nonlinear dynamics. And this is like my favorite thing ever. When I saw this paper, I literally lost sleep that night. I hope you get to experience that in your life sometime during research, or you read a paper and you go, oh my God, this changes everything. SINDI basically, instead of doing a data regression with a fixed model, it does a function regression. So if I gave you some data on a 2D graph, anyone in this room, and I usually pick on my 10-year-old son, could draw the line that goes through it. Okay, it's not solving a data fitting problem, it's solving a model identification problem. So it does the regression in the space of functions, and it works. It's one of these things that shouldn't work, but it really, really does. So what you do is you put in your data on the left-hand side, and then you have a function library evaluated at your data. And then you do a regression to find out what are the coefficients and therefore terms in this function library that best represent your data. There's more detail to it than that, obviously. But what I really like about it is that what you're putting in the function library are things that mean something. Okay. Like I said, it's a data fitting problem. Okay. That problem was solved arguably a century ago. You only put stuff in the library that's going to make sense, build models that make some sense for the problem you're looking at. So there's a lot of domain knowledge and basic modeling principles that go into it. And a flavor of SINDI that I'm going to use for this particular problem today is called weak SINDI. And it uses the weak formulation of a differential equation. Because this is a didactic lecture, I'm going to teach you some math. Okay, too bad. Hopefully you've learned something about the product rule in your time in calculus. Basically, it's the way of inverting when you take the derivative of x times y, and then you integrate both sides, how you reverse that process. The weak formulation of a differential equation basically is using a test function like an integrating factor back in calculus. Differential equation, if you multiply both sides of it by some smooth function, you can use the product rule, or basically integration by parts, to pick apart that differential equation. And if you choose your function that you multiply by wisely, then what happens is this definite integral term here goes away because you can set the test functions to be 0 at the boundaries. So the definite integral goes to 0. And you get this nice relationship between these two different integrals that then you can use to smoothly calculate the solution of your problem. And the reason why this is really, really nice for this particular data and this problem we're trying to solve is because it doesn't smooth the data. It looks for smooth solutions to fit your data. Because one of the problems that we all are familiar with once you start getting into data is overfitting, right? Basically fitting the noise. So by doing this integration by parts, this kind of weak formulation of your model, what you do is you effectively find solutions that are both fitting the data and smooth, okay? And there are other really, really beautiful, nice mathematical components to this, because when you do this in space and time, X, Y, Z, and T, you end up with this 4D convolution, this 4D integral that you can do very quickly with Fourier transforms, and that also allows you to filter out the signal and the noise. Happy to talk more about that if anybody wants that detail. So the way we apply all those concepts to this particular problem is by doing weak SIND on MRI. And we called this, localized convolution function regression because it's not purely SIND and it's not really purely weak SIND either. And, we're academics, so why not create an incredibly specific long title for something that's totally unnecessary? Although one thing we didn't do very well is come up with a clever acronym. So LCFR is what I'll say, but that's what that means basically. So what we're looking for are terms in a partial differential equation that are governing the fluid flow in the tissue. So there's passive transport, which is captured by diffusion. There's active transport, which is driven by the blood flow, which is advection. And then there's our source term, which is the concentration that we know is happening in the blood vessel. And what we're doing is these sliding windows. So we do these X, Y, Z, T, 3 by 3 by 3 by 3 over time windows. And we do this function regression. So we have the terms in the library. We have our data on the left-hand side. We have our terms in the big function library matrix theta, and we're looking for coefficients C that describe that fluid flow. And just to restate the morality of this approach is that the reason why I like it is because all these terms that we have in the function library are very specific transport terms with very specific interpretations. So, the diffusion coefficient in X, the diffusion coefficient in Y, diffusion coefficient in Z as like either a tensor or a component vector is something that we can directly interpret. Okay, so it's not about fitting the data. It's about trying to figure out what terms in this transport equation really are driving the fluid flow, because you can imagine it in different extremes being completely passive or completely active and any hybrid in between there. And I can't finish this slide without mentioning Ryan Woodall, who's now assistant research professor in my group, who really did a lion's share of this work. And it's really, really quite amazing algorithm, actually, for lots of reasons, one of which is because it's insanely fast. Okay, so one of our reviewers, who later confessed their identity because we're like, oh, come on, was like, how fast is this algorithm? What, and so we timed it and compared it to any other algorithms that try to do the same thing. And it's incredibly fast. Okay, so it runs in like 1 minute on a MacBook, as opposed to like a couple hours or many hours in other different kinds of methods. Okay, so it's really fast. But it's also very accurate. So we validated it many different ways. Okay, the first most obvious way to validate it is synthetically, because you have complete control over it. So what you do, here are two examples where you have radial flow on the top and laminar flow on the bottom. And what we're showing is that you can recover both the directionality of the flow and the flow velocity or the flow magnitude. Okay, very, very well. And then we validated it experimentally. So we had a microfluidic and put it in the MRI and put contrast agent through the MRI, measured its speed, and then did this algorithm and showed, you see the histogram there, that we can also measure in vitro the fluid dynamics very accurately. I mean, down to effectively a significant digit. And then we did in vivo validation. So again, in collaboration with Jenny Munson at Virginia Tech, we put some poor little mice into the MRI machine after giving them brain tumors. and computed all these fluid flow characteristics with this algorithm, and then compared that directly to the histologic sections where we could measure vessel density. We have a way to measure fluid flow with this dye Evans blue. And this white arrow that you're seeing is showing how the MRI completely predicts and this aggregation of blood flow in the histologic tissue. And so as a practical illustration of what this looks like, just zooming in, here's this algorithm performed on a mouse. This is the velocity magnitude, okay? And what I want you to observe from this graph or this picture is that there's a lot of variability, heterogeneity, these hot spots and cold spots within this tumor, okay? So the fluid flow is actually having quite complex patterns. And if you look at the diffusion coefficient, and rather than the velocity, which would be active transport, the diffusion coefficient, which is passive transport, shows you that there's a lot of hotspots outside the tumor periphery, actually. So there's quite a bit of fluid diffusion happening at the boundary, which is also going to be pressure driven and pressure gradient driven. But you can see that there's a particularly big hotspot up in the northeast corner of this tumor. Okay, so this is like a quantification specifically of all these features. And then you can integrate these things together to get a wind map, if you will, okay, a vector field of fluid flow in the tissue, and that's what this looks like. And the way I think about this is like if you were trying to predict weather. If you were trying to predict the weather and you only use temperature, you wouldn't have a great prediction over time, right? But if you add the wind and wind direction and wind speed, you can get a much, much richer perspective on the evolution of the system. And that's what this is. This is like a wind map in the tumor. But the other reason philosophically I really like using a SINDI approach is because what we do is we get an identified equation and model out of it. So this is taking that same, actually different mouse, not exactly the same one we were just looking at, but same study. And the data is on the contrast agent evolution over time. That's from the real mouse on the left. And on the right is the forward solution of the transport equations that we've identified. And they are not exactly the same, but the big features are the same. And that is that there should be aggregation around like the northeast side. There's a prediction that there's some south, fluid flow moving south of the tumor, et cetera. And so now we have kind of this balance between really data-driven algorithmic kind of analysis, which is like the machine learning side, and what we love, I mean, I think most of us in this room love, which is mathematical modeling. Okay, so now we have our transport equation that we can solve forward and do all kinds of stuff with. And it's really pretty fast and accurate. But because we're thinking about cancer, we're not interested only just in how the blood is flowing in and around the tumor, but we want to ask questions with it. And so in particular, we want to look and ask the question, is this fluid flow predictive of progression and invasion in brain tumors? And to answer that question, there's this hilarious story, okay? And I keep putting this in no matter the audience because people just love it, okay? Jessica gets total credit for this. There was this accident in a shipping container tipped over in the Pacific Ocean in the like 90s. And one of the containers was full of rubber ducks, and they've been washing up on shore ever since. Okay. And so they're all around the world, and people, scientists have been using it to study ocean currents and all that stuff. But the point is that we would think about things being transported in and around the tumor passively and actively, like ducks floating in a ocean or in a stream. Okay. So if you take all those maps I was showing you before, the diffusion coefficient, fluid velocity, et cetera, and now we call drop ducks, drop rubber duckies in and around the tumor area, you can start to create these path lines and these aggregation points where you would predict the fluid flow is going to transport material, okay? And you can take all those path lines and create a probability density map in and around the tumor, and you see this particularly hot region, right, in the west side of the tumor that then we can go through and histologically validate. So this is again the histologic slide of that same mouse and that same slice of brain tumor tissue where the tumor cells are dotted in green, and overlay that on the MRI and check if the fluid flow is actually predicting the tumor cell invasion. And so we've done that in mice and quite a few studies in mice, but also in with human data. So when you take for example, and these are just 9 example patients, and you do this kind of analysis, what you see is this big diversity of fluid flow patterns in and around tumors. So that's not always radially outward. It's not always inward. You get all these very rich, complex patterns that then can and do, not always, but can predict response or predict progression of patients after. Okay, so here's two patients, for example, one followed with two patients with baseline scans, one followed 5 months and one with a scan 8 months after. And you do this Ducky and pathline kind of analysis, and you find out that there are, in fact, predictive areas of where these tumors are going to regress progress. And we just published that earlier this year. We're very happy about that. So there's a very strong correlation between the pathline density and the location of recurrence or progression. And we're validating this now in a prospective clinical trial. So this is a two-site study, one at Virginia Tech and the other site being City of Hope, where we have the surgeon taking these screenshots of where the biopsy was taken so it can be localized, and we can correlate that vessel density, flow, tumor cell concentration with our fluid flow map predictions. There are two other applications of this approach that I want to talk about. One is to radiation. As some of you know, a lot of my background is in radiation planning. And the idea really is pretty simple, and that is that instead of drawing margins around the tumor that are uniform or based solely on just where the lesion's identified on the MRI, you can now compute this fluid velocity map and start to target regions that have low fluid flow and low blood volume, because these are regions that will likely be hypoxic, or you can target regions that are likely to progress, et cetera. And because it's so computationally efficient and derived from the scans the patients are getting anyway, you can really do a lot of all this computational post-processing before it even gets to the radiation oncologist's planning workflow. But another application that we're really, really excited and interested in is convection-enhanced delivery. So convection-enhanced delivery is when you use a pressure gradient to increase the distribution of drug in the tissue. So instead of passively giving it intravenously or through a catheter, you actually apply a pressure gradient through a catheter and accelerate the diffusion of the molecule into the tissue. And so you can imagine what we want to do is give a placement of where that catheter should go. So you're either taking advantage of the current high fluid flow, or you're putting it in regions with low fluid flow. And the place where we've started to do this, I don't know how you feel about it. I have mixed feelings, but poor little doggies. Turns out that dogs get primary brain tumors, especially golden retrievers. I have a golden retriever. Shh. Don't tell her I said that. Poor baby. Anyway, this is an MRI of a dog of a vet neurosurgeon, John Rossmeisel, where we've actually started doing some of these convection-enhanced delivery therapies for these dogs that have brain tumors. And so what we can do is everything I just told you. We do the analysis, get the fluid flow map, take that transport set of equations, and then run it forward to see where the CED should go. And then, for lots of reasons that may or may not be obvious, then he puts the catheter in that region for the dog. And outcomes are a little bit harder to measure in dogs than in people. So it's a little bit more of a feasibility and practicality study, but it's still a prospective test of this approach. Okay, so that is the summary. Rob. I put Rob's Box-Einstein space of mathematical models plot up here that he tweeted from 2015, because I told him last night after the poster session that I actually use this in teaching material for students when I teach. I'm talking about it, so I should just finish and then I'll summarize. So the Box quote, right, is all models are wrong, but some are useful. And the Einstein quote is make models simpler or simple, but no simpler. And so this is trying to plot the space of mathematical models as a function of complexity, wrongness, possibility, and usefulness. And like any good computational and math person, nothing like a 4D kind of plot to, I guess this is 3D. And I really think that this kind of approach of integrating machine learning with mechanistic modeling is really in that sweet spot. of models that are not too complex. They are not too wrong, ultimately very useful. And because the algorithm is, like I said, based in really physical transport parameters, you can argue how right or wrong it is, but it's certainly based in some foundational principles that you can argue. Okay, so the point here, I think, of this morally guided didactic lecture is that blood flow in tumors is a really important biomarker. Okay, in fact, it's a histopathologic feature of grade. And so what we've done is applied function regression, weak Cindy, to do data-driven modeling and parameter estimation. So you can use Cindy to estimate parameters for a fixed model. And that's kind of what we're doing here, although it's also doing model ID for a little, to some degree. And that allows us to really quickly and accurately measure blood flow. And we validated it computationally, experimentally, and in vivo. I mean, it's one of the things I'm really proud of, right? I hope you get an opportunity in your academic career to have a paper where you're like, you know what, I took this like as deep and as far as I possibly could, right? I mean, this is like super validated. Really proud of it. But that we can use fluid flow dynamics to do all kinds of things, predict where the tumor cells are going to invade, improve drug delivery for better tumor penetration. And ultimately, I want to use it to design combination therapy strategies so that we have knowledge of where this drug is going, and then drug A is maybe targeting one thing and drug B is targeting another thing, where we start to have some spatial control. And actually goes to a comment Sandy made earlier this morning about how we can modulate the environment, things like that. Okay. So once again, thank you. I got some important faces up there in the top. But thanks for the invitation. I really appreciate it. And thanks Sandy and Kristen again for organizing this meeting. I mean, if you just bought that, then you weren't paying attention. Yeah.
Yeah. Thank you. Yeah, I know that you mentioned that the and I was wondering, have you done any spatial analysis on this? And did any length scales come out or any fractal dimensions pop out of this? And did you find similarities across them?
Oh, that's a great question. We didn't do any fractal analysis. That's a pretty clever take on it. The other word you use, pathological, is actually something that a PhD student in Jenny's lab just defended her thesis on spring of this year, where she went and did basically exactly that, dynamical systems topology analysis, looking for sources, sinks, separations, et cetera. And turns out that that is incredibly sensitive to variations and noise. And so not convinced that's a good way to do it, but it's a good question. Yes, I mean, that is something that we actively are looking at and wanting to quantify. Another idea we have is using divergence. So you just compute overall divergence and see if it's positive, negative, or whatever. But yeah, good question.
Over here. So very cool work. As we know, the tumors are very dynamic, and I would expect those flow patterns to be highly affected by things like changes in blood flow in individual vessels, changes in porosity in the tissue.
Yeah.
So have you looked like from hour to hour or over the next day to see if those flow patterns change?
I mean, this is also a great question. Yeah, something that we're thinking a lot about and doing a lot of studies. Best way to do that is with animal models, so you have a lot of control over it. So yes, those are studies that we're doing, but I don't have a good answer for you yet about how we think about those changes from like a modeling point of view.
I have a question for President is, can Cindy be used for identifiability analysis?
Can't really think. I don't. Clever question. Maybe I could see how it could work. But Cindy actually benefits from two things. One is the sparsity of the function library, and the other is the phenomenon of double descent. And double descent is the phenomenon of when you have a model you're fitting to data and the parameters of your model have an extraordinarily higher dimension than your data. Then you start to both overfit the data, but then somehow you have this variance bias trade-off that then allows you to generalize better to test set and out of distribution kind of tests. So I think you could use Cindy in that way. But I don't know. I don't think about it as an identifiability analysis,
Okay.
but we could talk about that later.
Okay, one more question. The model have shown that the floating ducks on the ocean, but the ducks are kind of inanimate objects, and the way the tumor cells can interact with the environment, ducks cannot. So,
Yeah.
any thoughts from that perspective?
Yes. Yes. I just use the ducks analogy because people love it, but it's very not perfect. Yeah. So drugs are passively transported. That's why it's a good analogy. But cells, one of the things I didn't talk about, but I'll just say real quickly, is like cell-based therapy. So like CAR T cells actively transport too. And in that case, duckies are not a good analogy. Okay. Thanks.
Okay, thanks again, Russ. Okay, he's now going to take over chair duty.
Yeah.